So much of the world is a meat grinder, but what I will definitely say for sure is that being a crazy person in America in 2024, boy, that's a different kind of meat grinder. The interest in mental health in this country is almost barbaric. There's still always that lurking threat that if I speak to the voices in my head at the wrong time, I will be arrested and put in a hospital. People with a variable neurology, it feels like you will inevitably be boxed out of certain futures, certain opportunities, certain considerations, and certain rights. Looking at the grit and the grain of our society, that's the truth. We haven't hardly evolved. We haven't hardly evolved as a culture. We're just putting the problem away.
We as a nation have neglected too long the mentally ill. It affects all of us. Our chief aim is to get people out of state institutions and back into their communities and homes without hardship or danger.
With this heartfelt plea, President Kennedy launched his personal crusade against mental illness. John F. Kennedy is gone, but his words keep echoing and re-echoing in our minds and in our hearts.
A mental hospital, they call it. A place where they'll lock you up and then throw away the key. And now they've got me, too.
Under the guise of civil rights, a great many people were turned loose from institutions who did have mental problems, or there was retardation, whatever.
What happens to all of them? The men and women from every walk of life who each year pass through doors like this, into the mental hospitals of our land.
How wrong I was. Or no, not wrong, sick. And now that I'm well again, I can't help feeling just a little sad, the way you always do when you leave a place where you lived, learned, and grown. I suppose there'll be some folks who'll stare and talk and sneer. But no matter what they say or do, one thing I know. These people here, this place and time, have given my life back to me.
I'm Diana Nichols. Do you want to know? I'm retired. I'm a retired teacher. I have two boys. My oldest son is John. He was always busy. He walked at 9 months, but he climbed way before then. He's small. He's physical. He's incredibly strong. He's so creative. If I were to be dumped on a desert island, I would want John with me. He's the guy who can pick up a piece of debris and build a generator. He's brilliant. And in many ways, he lacks wisdom. He has a way of rubbing people the wrong way. He can be very abrasive, and he's always pushing the limits. When John was in 6th grade, we had a call from one of his teachers, and he said, "We have a problem. John's questioning my authority and questioning my process, and this has worked for me for years." So John was in trouble right off the bat. He was diagnosed that last fall with schizophrenia, even though we've known for years that he's had mental health issues.
Well, my name is John William Nelson, and I've been diagnosed with paranoid schizophrenia, schizoaffective disorder, tentatively PTSD, ADHD, and I'm sure if you tried to hammer it out, I'm sure you could find a number of other disorders, but I think there's a reason to keep people mentally ill. There's a reason to keep people down. We're much easier to manage if we don't have rights. And if you label somebody with something like schizophrenia, well, you could pretty much count on their rights being removed from them. The nature of the hallucinations are such that they would tell me that they were everything from outer space aliens to, interdimensional reptilians to sorcerers to ghosts. They loved to tell me that they were ghosts. And then about 4 years ago, it switched. They started threatening kids I didn't know I had. And then for the last 2 or 3 years, it's been pretty much just them bragging constantly about the horrifyingly evil ways they murdered my kids who I never got to meet. All I can do is hope that what I'm experiencing constantly does not have reflection in reality. And it's exhausting.
Coinciding with his mental health issues, he's an addicted drug user. And we're talking hard drugs. We're talking meth and fentanyl. But in the fall, John had a psychotic episode. Well, during this episode, he tried to lock his roommates in a bedroom by screwing the door closed. He asked, "What do I have to do to get you out of here? Burn the house down?" They called 911 and the police came, and instead of taking him to jail, they took him to Mind Springs, the local mental health facility.
New developments surround the only mental health hospital between Denver and Salt Lake City.
The hospital they relied on for treatment caused them more harm than good.
3 state agencies will audit Mind Springs Health in 10 Colorado counties.
Extraordinary regulatory scrutiny.
Troubling complaint.
Compromised its service to the community.
The Mind Springs situation has been problematic for some years now. I've actually spent 18 months as the hospital administrator over at Mind Springs when the feds were threatening to shut them down again. It was a gotcha culture. Everybody emailed everybody everything all the time because they were afraid somebody was going to come back at them. They seemed to not want to share data, and they routinely say no to clients that we feel should be there.
The best thing I've ever heard about Mind Springs is you can get laid there. That's not what you want to hear out of a mental health facility.
I'm a mom, and the person who I will be talking about is my son. I can't describe how bad it was. He was yelling at us all the time. He's scary. He's not himself. He would just sit on the couch fantasizing about killing himself in front of me. And he had a butcher knife, and he was holding it to his throat. He just wanted me to feel his pain. So I was on the phone, and I'm talking to 911. Finally, the cops got there. They take him to the local mental hospital. They put him in a room with a mattress covered with plastic on the floor, nothing else around, all gray walls. It was so awful, and it was cold. It almost made you feel mentally ill.
The Eagle River Valley has faced significant behavioral health challenges. Anxiety and depression jumped 465%. Alcohol and substance use increased 332%. And we saw a 3-fold increase in middle schoolers who reported making a suicide plan. Our community was hurting.
I think the community really came together in Eagle County because so many people were recognizing the lack of services. We live in a rural resort region, which draws a lot of individuals from the 18 to 28 age range. And so we have a lot of specialty care that really focuses on that population. Continuity of care has been key. We want to make sure that when somebody is at the highest level of care, we're already thinking about how they and their family receive the support they need when they're discharged out of that highest level of care.
2017 was this pivotal moment of, hey, here's an opportunity to create a tax, the marijuana tax, which would ultimately spin off some amount of money to start doing this work. I think at that time, everybody realized that it couldn't be done by one entity, that the only way we were going to accomplish this is together. Every local government, the school district, law enforcement, healthcare entities, community members, advocates, everybody is working on this together because we all recognize that it's our community's problem. It's not the hospital's problems. It's not the government's problem. It's not the school's problem. It's all of our problem.
I think they've got a wonderful idea. I think they got key community members to commit. They unhooked from Mine Springs, which was something they felt like they needed to do. They were creative in how they went around getting tax money, which is a very damn difficult thing to do here. And they're working together. How long it will last, I don't know, but I think it's wonderful in the short run. I think they're doing a ton of things right. I think community collaboration is terrific. It just doesn't last.
¿Qué es lo que sucede realmente? Yo no siento a Colorado como un estado preparado para navegar con este terrible problema que estamos enfrentando, porque es devastador lo que está sucediendo y no siento que es un estado preparado para esto. Mi hijo ha estado en más de 15 hospitales de salud mental. En lo personal me considero una mujer sumamente fuerte. He tenido depresiones fatales, he tenido episodios de ansiedad fatales, sobre todo a raíz de lo que sucedió con mi hijo. Pero a pesar de eso, siento que he tenido la fuerza y la valentía y la mente de poder, cuando estoy en un ataque de ansiedad, pararme y decir, no está pasando nada, tranquilízate, todo va a estar bien. Sigue siendo totalmente carente y decepcionante, y no solamente para la comunidad latina. Proyectos como este pueden ser el inicio de una preparación. Pueden parecer cosas pequeñas como dar testimonios, como brindar algún tipo de ayuda a personas que realmente estén preparadas. También pueden aportar su granito de arena. Digamos que estamos en pañales.
My experience, I've always been on the outskirts, never really felt welcome in society. So even to this day, I try to avoid as much interaction with society. And the voices keep telling me that I am this monster. But also the system kind of helped push that idea on me, that I was never going to be healed, that this was forever. Every time I get surrounded by police, which is very intimidating.
A pickup truck crashes into the lobby of a police station in Colorado. He told investigators he was being followed by several cars. The suspect steps out of the truck with his arms up and is ordered to the ground. Police swarm the driver and arrest him.
Certainly, mental illness is nothing new. As far as for law enforcement, we are responding to the behaviors. What's causing the behaviors? We don't know, but we will make it safe and we will transport that person to the best of our ability to whatever resources available and open to take them.
We are the incarceration nation with the highest rate of incarceration of the world, and much of that driven by the unmet health needs of people whose crises lead to law enforcement response and associated criminal charges, and then an endless plunging into the depths of the justice system as a consequence.
What you find in an incarcerated setting is a lot of mentally ill people, a lot of severely untreated mentally ill people. And they're criminals, sure, they've broken laws, but there's no investigation culturally into what causes those crimes to be committed in as far as a person's consciousness is concerned.
This challenge is a challenge nationwide. Every community has this experience, and the consequence, as we've all seen, is people living under bridges and in parks.
done in society. I know that. What you want, baby? She's pretty hyper, and she likes to chase them four-wheelers. Here's not good. It's time to wash your face, Betty. Well, I'm not hiding. I'm out in the open.
But we're not telling everybody where we're at. We're just saying in the desert. Yeah, because we don't want people coming down looking for a hassle.
We have those come through here too. Get the hell out of here. Beggar and pig and all that kind of shit. I just tell them, go on by.
There's a high prevalence of mental health need amongst that population. There's a lot of harmful substance use, and we're in the midst of a terrible epidemic of overdose deaths, and that's associated with it.
Addiction is a disease. Addiction is a mental illness, and it's not always a choice. It has to do with moral failings to begin with, maybe, but most addicts don't want to be addicts. They're trapped. That's what an addiction is. It's a chemical prison. When you pursue treatment, insurance tends to favor you a little more. If you fall off the wagon, they will be much more reluctant to help fund your recovery or any treatment in that direction.
Please hold the line.
Insurance is so incredibly challenging. It's so hard to get a straight answer about what is covered by behavioral health. It can take our providers upwards of 6 months to be accepted into insurance panels. Often patients come into an inpatient hospital and feel like it's not supportive of their true healing. Discharges before patients are ready happens. Oftentimes the payers think about medical necessity. That can have a big impact.
Mental health has become more of an afterthought versus the primary thought. Unfortunately, the medical model in this country has focused primarily on the physical aspects, chronic disease, illness, and not realize that it's your behavioral health many times that leads to those chronic diseases. The bigger effort, of which nobody is talking about, has been how do we get insurance companies to pay fair, equitable rates for behavioral health care. If we could do this across the entire country, what you would see is more people in behavioral health that are doing cash pay only now would start accepting insurance because they get reimbursed at a rate that can actually be sustainable.
Your call is important to us. Please hold the line.
We passed a parity bill here in the state of Colorado that behavioral health services be covered on par with the way other services are covered. That went into effect, but it had limited application to a subset of payers. And just because we pass a law doesn't mean that all of the people suddenly start obeying the law.
We apologize for the wait and will answer you shortly.
Behavioral health care across the nation has traditionally been so segmented. Inpatient, intensive outpatient, integrated behavioral health. Different organizations run all of these different levels of care. There's a referral process, a scheduling process, follow-up process.
In a nation that's got nearly 400 million people in it, it's such a huge scale of challenge to talk about systemic approach to supporting people's health.
Closed at the moment. Please leave us a message and we'll get back to you shortly.
Would you like to see something really incredible?
See firsthand how the seeds of insanity might be lurking this very moment in the sanctity of your own home.
Today, we no longer punish the mentally. We have come a long, long way.
Don't let strangers make the most important decisions of your life.
Because only a very, very few seem to care.
It's not just about the stigma itself, it's about the level of ignorance that people willingly assume when they are talking about matters of mental health.
My life, but I don't really have a life. Besides going to a few appointments here and there, I just isolate in the room that I have right now. I isolate there most of the day.
It's very, very easy to adopt the idea that us and them is a relevant way to look at mental illness.
I'm afraid of people seeing the monster that I supposedly am. Just the anxiety that I feel in general, being around people.
No sé en otras poblaciones, razas o culturas si sea lo mismo, pero para nosotros, dentro de nuestra comunidad, nuestras costumbres, nuestras tradiciones, todavía el decir salud mental para muchos de nosotros es difícil y para otros es simplemente imposible y cierran las puertas hacia buscar una solución.
The general population has to be convinced that it is in their own best interest to empathize with the severely mentally ill.
Mental health and mental health stigma have taken on this sort of intangible meaninglessness. So what we've preferred to do is talk about discrimination.
I have sent to the Congress today a series of proposals to help fight mental illness. It has been tolerated too long. It has troubled our national conscience, but only as a problem unpleasant to mention, easy to postpone, and despairing of solution. The time has come for a great national effort.
1 in 4 Coloradans will experience a mental health or substance struggle each year.
We have an ability to take action with regard to addressing discrimination.
Mental health! Mental health! Mental health! Mental health! Mental Health Colorado has already heard from people in several cities, from Pueblo to Greeley, Fort Collins to Grand Junction.
I apologize often for the name of our organization, Mental Health Colorado, because I don't really believe in mental health. I believe in health.
These 3 barriers for many people who need care.
It's all about treating people differently on the basis of their conditions and identity. You might seek care for your cancer more readily than you're going to acknowledge need for care for your bipolar condition. What that is internalized discrimination that comes from the culture.
Mental health! 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 Mental health!
It's challenging for a state to wrap its systematic head around a very divided rural frontier of nearly 7 million. But where the solutions may become more readily accessible is when you get down to the regional level. Wraparound care, it's our state-of-the-art approach. And what it does is it recognizes that people's needs are complex, that everybody's going to benefit from the least restriction possible. It really helps to have substantial financial commitment to an effort like this. And not all communities are so fortunate as that.
We are going to be able to show that there's a more efficient, affordable way that's more effective to deliver health care to our community than the historical medical model. We want people to come here and see us when they're feeling good and just keep staying good going forward.
When I think about recovery, it's not we're all the way well, but recovery is a plan that's uniquely and individually created to say, this is what's going to work for you. And it's going to follow you out that door. And you have a plan for tomorrow. You have a plan for next week. You have a plan for 6 months from now. And it might change, but you're comfortable with knowing what's going to support you.
At the end of the day, it's about connecting with people, really listening to what they have to say and what they feel they need. I don't care what diagnosis you hang over their head or multiple diagnoses. They're people. We need to connect with them. We need to try to figure out in a perfect world how do they want their life to look, and then see if we can help them get that. One of the things is housing so that people have a place to go where they belong.
I want to live, I'm tired of surviving. I wish I could just live a normal life, and I do want to, I want to be integrated back, to be welcomed back so that I could have more purpose.
We really want people to have that purpose. What is my purpose in healing? And how do I connect that purpose to my outside community? And how do I bring that all together?
I have people that advocate for me, and I have great parents that are still willing to put forth effort even into my 35th year. Without loving and supportive parents, I would be screwed. And that's how it is for people who don't have the support I have. That's just a fact of their lives. People are abandoned every day because and they're slapped with the label I possess.
Our intention was not to duplicate services already in the community, but to serve the uninsured, underinsured, undocumented, and underserved people in our community.
Provide a place for people to take a shower, do their laundry, get mail. We have medical services there.
Any kind of resource that a Native American needs, we're there. We advocate for them. We walk with them to the appointments. We help them fill out the applications. We explain what they're filling out, you know, what kind of services. We go to the appointments with them if they need it.
It's really fun to be able to provide opportunities for enrichment in our assisted livings as well. So we do awesome things like potentially go rafting in our brain injury program or our cottages.
That's the way that you bring people together, is you understand their story, you understand who they are as humans, because it makes us closer.
With the MAC team, that's a multi-agency collaboration. 4 different mental health providers, clinical providers here in town that leverage some peer support.
Spending some time treating somebody as a human being has a huge therapeutic value, not just for the person on the receiving end, but also for the person practicing that level of humanity experiences a lift, because it's one of those P's, it's that sense of purpose. What better thing do we have to do today than spend some time with somebody who needs it?